Yeah, this session is being recorded, so please bear that in mind if you're sharing your name or your screen. Depending on what your preference is, you might wish to change what you're sharing. And recording this is also an opportunity for people after today to participate, even if they might not be able to come along this evening. I'm Morgan Carpenter. I'm the Executive Director of Intersex Human Rights Australia. And this session is being run with colleagues and friends from Interlink, from Intersex Aotearoa, and also independent advocates as well. And we're going to talk about 5 years on from the Darlington Statement, which is a community consensus statement. And Bonnie is just putting that up on screen. And maybe, Bonnie, if I can pass over to you before we begin properly.
Thanks, Morgan. Hi, everyone. Welcome here. Happy Intersex Awareness Day. I'd like to just start by acknowledging that we're all meeting today on Aboriginal and First Nations lands throughout Australia and in Aotearoa, New Zealand. I'd like to pay my respects to the elders of the different lands in which we've met, past and present, and extend my respects to any First Nations people here today. I think it's important to acknowledge that there's been a long history and much to learn about ways of doing and being in our countries that aren't necessarily like aligned with colonizer Western frameworks of how to be and do in this country. And we can learn a lot from the resilience of First Nations people in terms of the face of colonization as we move forward. Please feel free to share the land that you're on in the chat. I'm coming today from Gubbi Gubbi country up north. Thanks so much for coming today. Mani, I would like to hand over to you so you could do a welcome as well.
Kia ora everyone, and yes, Intersex Awareness Day. And I just want to take a moment because I guess I'm standing here as the elder of the group. I've been thinking a lot today about those who are no longer with us, you know, the people who helped start this movement and who are no longer here. So, you know, there are a lot, I was thinking about it, there are a lot of names. So I just want to pay respects to them. So this next process will just introduce the panel members. In Aotearoa, we would call it whakawhanangatanga. So it's about making connections. So my name is Mani Bruce Mitchell, though my first birth name was Bruce, and that's a long, complicated story. I grew up in the centre of the North Island beside the Whanganui River. So on my dad's side, he was a laird and whakapapas back to Scotland. On mum's side, she was a Milligan and whakapapas back to Ireland. So very much Celtic ancestry for me. So here in New Zealand, I'm a Pākehā person. I was the first in my family to have tertiary education, which is interesting because while it opened up my world, it also separated me again from my family as doing something that was quite different. Everybody else in my family went into trades. So that is me, and on my screen, Bonnie, you're beside me, so I'll pass to you to introduce yourself.
Thanks, Mani. My name's Bonnie Hart. I'm an intersex woman. I use she, her pronouns. And I was born in Meanjin in Brisbane, and my family moved up and down the coast of Queensland growing up. So I'm 9th generation colonizer Australian, and with ancestry that harks back to you know, Celtic and Anglo ancestry. I feel very privileged to be here today. Jelly, I'll pass over to you because you're next on my screen.
Kia ora everyone, ko Jelly Tukalingua. I'm in Poneke, so Wellington and Aotearoa, New Zealand, and Jelly O'Shea, so I'm the work for Intersex Aotearoa, and I'm an intersex person. I was born in Otipoti, Dunedin, to a 3rd generation West Coaster, mining and tree loggers that came over from Scotland, Ireland and England, and my dad was born in Sussex, in the UK, to Irish parents who were chimney sweepers, and yeah, really excited to be here with these amazing colleagues and friends tonight, and many of you in the audience who I know as well. Thanks for joining us. Over to you, Morgan. Thank you.
Thank you, Jelly. I realized earlier this year that I'm a migrant and I've been in Australia for 20 years. I don't have a history or a family history in Australia. I was actually born on the edge of Birmingham in England, and I've spent most of my life outside the UK, particularly in Ireland and then Australia. So I feel a bit of not a wanderer, because I feel like I've settled very much in Australia. And it's really where I feel is home now. And I realize that means I have to do my part in addressing the consequences of colonization on this land. So yeah, I'm really glad to be here and glad to be a participant in the discussion today. And I'm looking forward to it. Mani, I can just pass back to you. Would you like to add anything to the discussion, or should we begin?
No, thank you, Morgan. I think you know, in an ideal situation, we would then share with who's in the room, but I suspect that would take all night. So I just want to honour all the people who are joining us. When I say tonight, it's tonight for Jelly and I know it's early evening, and for most of you in Australia, but you know, what an extraordinary event that we're having this tonight. And I just want to acknowledge and honour everyone who is here tonight. So Morgan, back to you.
Well, thank you very much. So we're here tonight to, I think, talk about 5 years of the Darlington Statement. And if you're not familiar with the Darlington Statement, I'm going to share a link in the chat so that you can take a look. The Darlington Statement is a declaration or a common platform by and for people with intersex variations in our region, in Australia and Aotearoa. It builds upon an earlier statement in 2013 that was drafted in Malta, but it really was an attempt to set out a common agenda for intersex organizations and advocacy in our region, in our 2 countries. So it occurred, I think, with a lot of support, both from Intersex Human Rights Australia, then called OII Australia, but also from Intersex Peer Support, then called the AIS Support Group Australia, and also the Intersex Trust, Aotearoa New Zealand, which is now Intersex Aotearoa. We've all changed our names, but I think our purpose really remains the same, that we're all trying to promote the health and human rights of people with innate variations of sex characteristics. We also received a lot of support from LGBTIQ plus Health Australia to help run the event and really bring people together from our two countries to identify our common issues and in the closing afternoon of the event to actually draft a statement. The event took place in Darlington in Sydney, and there were roughly, I think, 30 people from our two countries there. Our organizations were represented, but not everybody who was there represented an organization. People who were visible in communities in our countries who weren't associated with organizations were also invited to participate. I want to just start off by maybe asking Bonnie and Mani as people who were present about what it meant for those of us who were there to contribute to the statement and what it meant for us to do this. Bonnie, would you like to kick off?
A big question. I suppose what it meant for me personally was it was a natural progression. Do you know, like having spent many years going to peer support and facilitating peer support and having conferences, there was always so much conversation about how to change the systems that weren't working for us, and that there was, you know, like there became quite a struggle and a tension because many people just needed support, and so many people couldn't hear the same stories over and over without wanting to change them or wanting to change the systems that weren't actually affirmative and weren't providing those the types of services that people need, or the type of long-term care about the impact that those services might have. So the Darlington Retreat was a mechanism to try and create a discrete space where people could start to talk about structural change, could start to expressly look at how the systems were failing us and what an ideal space would look like. And we were in a wonderful building with lots of different rooms, and each room had a different focus, and people were able to move between each of the different rooms and share information about what they would like to see, what they thought the shortfallings were, and you know, what their priorities were. There was also a crafting room where we got to make some fun t-shirt material, and so it was a wonderfully facilitated space as well. It could not have been done without the financial and structural support of the then LGBTI Alliance, LGBTI, and that because, you know, so often in this space we do everything ourselves. Do you know, like we run the events, we're participants in the events, we look after other people, we facilitate it, but to actually have an organization dedicate funding and resources to be able to supply us with a space to have a conversation resulted in the Darlington Statement, which fundamentally, I don't know, like has been, I start to call it a fixed point to move the world with. Do you know, once we had a template that we could agree on something, then we could share that, and the Darlington Statement could do the work of millions of words that we were all speaking to people all of the time. The Darlington Statement started to be able to do that for us. So I feel very strongly about it. Like, it really helped galvanize a community in terms of like our common objectives, and really the ability to be able to work together to try and achieve something that turns out to be incredibly monumental, still valid and impressionable 5 years later. Yeah.
Thank you. Marnie, you were at the Malta retreat as well, a Malta event that was a precursor to the Darlington retreat, but maybe you'd like to reflect on your experience of the Darlington retreat and the statement.
Well, my mind is just crashing with so many memories. So I go back to the first funded gathering of intersex people on the planet, which of course was in Brussels. And I'm not meaning the first retreat in 1996, but when activists were funded to come together in Brussels. So Brussels was the first one, and then there was the conference in Stockholm, and then the Malta retreat, and that's recognizing that. So each of those gatherings built, but these were very much Northern Hemisphere gatherings and narratives. And the one thing I was thinking about is, for those of us who came from this side of the world, you know, arriving in places jet lagged and trying to, you know, get into the time zone and get our brains functioning. So one of the things for me about Darlington was it seemed like a relatively short trip, you know, to get there and just being around people and not being jet lagged. And yes, Bunny, I want to taitoka what you've just said, you know, the awhi and the support that we were held in that space. And I'm thinking, you know, we had an Aboriginal opening, and the person, you know, who did that told us the story of, you know, for him going back to country, and the story beside the river that was both salt water and fresh water, and you know, that narrative around genders and between and putting that cultural component into the conversation as well. And you know, what came out of those days I still find remarkable, that, you know, we started with nothing and that we ended up with the core of the Darlington Statement is extraordinary. And it was a synthesis of everyone who was there, and quite a different document to, I mean, it was more substantive and much more nuanced than the documents that existed up until then. And while, you know, we've added to it and it needs to probably have a new updated iteration, it stands the test of time. And it is a brilliant foundational document that potentially can do so much. I think it is the vision for what we want. What it wasn't, and one of the things I'd like to reflect at some point tonight is, how do we make this happen? And there is not one thing to how to make this happen, but being more aware and in tune with where we are on the planet, because the planet is also not the same as when we gathered for that gathering. Like, it's a much nastier place, and you know, we're one of the target groups of the nastiness that is going on in planet Earth. So how we make that happen, I think, has become more complicated. But yeah, I just want to acknowledge that it was an extraordinary event and profoundly important in my journey. And yes, sense of humor, but I loved the fact that I could be there and I wasn't in appalling jet lag.
Yeah. Thank you, Marnie. Just to add to both of your comments, I mean, from my point of view, as somebody that has been engaged very much in advocacy since at least 2009, 2010, and actually trying to change systems for that long. My experience is that many different stakeholders or interests have long had very different ideas about who we are, how we should be treated, how we should be recognized, how our issues should be dealt with. And we see quite a number of different, really ultimately contradictory ideas about who we're supposed to be and how we should be treated, particularly in medicine and law. And for me, the Darlington Retreat was an opportunity to try and set out a path that was community-based, community-informed, and that could navigate between those different, often competing ideas about how we should, who we are and how we should be treated, to try and achieve this idea of a common platform. And while I absolutely do recognize that it's not perfect and there are things that can be improved in the document, and we have added to the document, if you have a look at the darlington.org.au website, then I think it has provided a common platform, and it's helped to address some of the different conceptions that different stakeholders and institutions have had about us, so that we can say this is actually a shared perspective, that we have agreed between us that this is what we want to see, this is how we think we should be treated, and it's how we want our issues addressed in policy and legislation and healthcare. But I mean, Mani and Bonnie, feel free to comment if you like. But I also want to move on to Jelly, who wasn't at the Darlington Retreat. And I just want to ask if you've got anything, if you'd like to comment on what it feels like to come to the statement after it was created.
Yeah, thanks for that. And it's actually just a pleasure listening to you all speak about its conception, because for me it was like the sense of coming into a space where there was this defining contract between you all that sort of bound you to something, and that was really inspiring to see the intention and the motivation and the mobilization of all these ideas. But maybe I never really got to just hear about how that happened. So it's actually so lovely to kind of get the nuance of that experience for you all. And so for me, the statement, I got to go to I think it was the second retreat, D2, yeah. And that meant that I got to meet the most intersex people I ever had met before, all in one go. So I guess I was kind of somewhat distracted by that phenomenal occurrence. And then once I was able to sort of rest and listen and be amongst such minds, it really, I think, has grounded a lot of the practice for me as like a young advocate and activist at the time, you know, feeling those feelings of seeing the same replications of harm happening, and that frustration, not knowing really where to put it, and wanting to, you know, throw rocks, and being able to have this amazing tangible tool that I could be like, look, someone's already done the work. You know, it's summarized so articulately in this document, and that's kind of exactly how I've used it. And I think what I love about it as well is the helplessness that our allies and friends and family often feel, just giving them the opportunity to affirm it, to be able to go, hey, you can actually just go on the website and do this thing. And yeah, this is intimidating. It's overwhelming, even kind of seeing people not wanting to get it wrong. So the sort of frozen state that a lot of people might sit within in their attempts to love us and be in relationship with us. You know, if they struggle to articulate things, they can point other people to this as well. So I think it's a real gift that keeps giving in that way. And I think it's so lovely that it has an operation to it, you know, that it actually isn't a passive thing, that it's a proactive thing. So yeah, there's just so much to say about it. It's a conduit, it's a magic wand. It's I think it's an alive thing, and the fact that there's been consideration in it that you know, our voices will continue to expand and change, and that can be reflected in it, that it's not set is really important, and speaks to the people who made it, you know, that it's not sort of like, it's not attached to ego, it's able to develop as we develop is really special.
Thank you, Jelly. I mean, that notion that it's not attached to ego and it's actually a common platform or a shared platform, a shared statement, I think is really, I think, one of the most important things about it is it's not about us as individuals. It's not even about our organizations. It's about what we have done together to identify a way forward. We should go on and identify just some of the benefits and the positive uses of the statement. But before we do that, I mean, there are a couple of areas in particular that involved a lot of very detailed, long and careful consideration. And I think the most complex areas were the statements about prohibiting deferrable medical interventions, and also the language about identification documents, and about sex classifications, sex and gender classifications. And in some ways, both of those two areas have been perhaps the most controversial about the statement. Bonnie, Mani, Jelly, would you like to comment on maybe the statements about deferrable medical interventions? I should note that our platform in those areas has not been fully implemented by any jurisdiction in Australia or Aotearoa. We're still in a situation where across our countries, deferrable medical interventions still persist with impunity. So the issues that we've raised have not actually been addressed. But trying to get the language right, I think, has been a powerful tool for us in trying to get those issues addressed. Maybe Bonnie, would you like to add a comment?
Yeah, there's been a long history of people calling for moratorium. If that's sorry, that on deferrable interventions, dating back 20, 30 years. Do you know, like it was not even new, but to actually write it down in words and then be able to share that as a form of consensus was again quite powerful. I think, you know, like I don't remember there being too much, like in terms of like in terms of the actual drafting of the words of prohibition, point 7 in the Darlington Statement. I don't remember there being too much disagreements around that. Correct me if I'm wrong at the time, but certainly when trying to talk with clinicians about the Darlington Statement. When we talk about high level stuff, we can be in agreement, but when we actually get to the process of hard protections that are more than just some standards or recommendations, and we actually start to talk about changing practice through legislative processes, there's still incredible pushback around those. I think the power of the Darlington Statement, it was our community consensus statement, and we can use it in that way because we went through a consultative process. We tried to make it as representative as we could feasibly do with the, circumstances that we were existing in. And to be able to counter clinical consensus statements that really positioned no consensus. So they're like clinical non-consensus statements generally outline how there is a lack of consensus and there's a lack of consistent evidence, and there's more research that needs to be done, and everyone should get peer support. But all of these types of things that people agree on but don't communicate to change of practice in a way that's meaningfully engages consumers and the demands that we've been feeding back to medical systems and structures for decades. Acknowledge that it is Intersex Awareness Day, and that this day celebrates and commemorates one of the first visible demonstrations of people with lived experience standing up to pediatric biomedical belief about normalizing intersex bodies to mitigate the impact of social stigmas by changing bodies. So to be able to actually communicate that kind of stuff without the cost of it on the individual through a statement, it's been very powerful.
Thank you, Bonnie. I mean, just so to add to your comments, I mean, my recollection is that this was the first time that we had tried to articulate what it was that actually we want in our region, what we want in terms of legislative reform. And I think the call for a prohibition as a criminal act of deferrable medical interventions is a really powerful statement. And the wording doesn't only call for prohibition, a criminal prohibition, it also recognizes that the key marker of whether medical intervention is acceptable or not, it is whether it alters sex characteristics, whether it's deferrable, and whether the individual is free and fully informed personal consent. And I think that articulation, perhaps, if we were writing this today with the benefit of 5 more years of experience, we might be articulating this a little differently. But I think those principles really remain the same. And I think also that we are seeing pushback still from some clinical stakeholders, particularly, I have to say, in pediatric surgery, pediatric urology, pediatric endocrinology. But if we look at psychiatry, at mental health, and if we look at medical students, we can see very clearly, very powerful and clear arguments to respect these principles and respect the human rights of infants, children, adolescents, and adults with innate variations of sex characteristics. And I think that has arisen in part because we've been able to articulate the issues so clearly. Marnie, do you want to add to that, or Jelly? Marnie, maybe?
Yeah, I did a presentation today and I was talking about my history working in local government and civil defence. So my background was in emergency services. So the practice there when you have disasters or things go really wrong, there's a whole process where you sit down and debrief and work out what went wrong and, work towards making sure that never happens again. So I was very familiar with this practice. So I remember, at that first conference in 1996, sitting there under the tree, and I could hear the similarity of all the stories. And I thought this will be really easy, but we will go and we will tell the doctors and they will hear that this practice is so terrible and doing so much damage, and it will change. It never occurred to me that there would be resistance or pushback, or there would be no capability of the medical model to hear our stories. So it is somewhat traumatizing to be sitting here 26 years later and we're saying, we've made these steps, but we have not yet made that breakthrough. And I did not understand that we were up against, one of the most powerful models of white supremacy and heterosexism that exists, and that we are really the victims of that the medical model is so profoundly powerful to reinforce this normative notion of bodies and the binary structure. And so we're collateral in that process. And so when I was thinking about, what is the next step, we are getting there and we are closer, but yes, the pushback continues, the practice continues, people continue to be traumatized and damaged by this model. But then I want to hold what we did. We stood, all of us, with our trauma stories and went, no. And I articulate in such a beautiful, precise way what it was that's wrong with this model and what it looks like to change it. So yeah, that's what I want to say. And again, there are people here and with us tonight who were part of this process, and I just want to acknowledge, this was a synthesis of many, many brains and many brave sharings and collection of processes and ideas to bring the reality that is the Darlington Statement. Thank you, Morgan.
Thank you, Marnie. Jelly, would you like to comment as well?
Yeah, I guess it's just to affirm what's already been shared, and particularly that point, Bonnie, you raised, and then of course you've both echoed around that the sort of sneaky cleverness of saying, oh, there's a complication or a cacophony of voices that have different wants and needs from those with lived experience. So, the medical pathology has such a hard time, it can't possibly affirm just a few voices that haven't had a positive experience. And I see that still now, that that division being sowed by those who, at work in the medical profession in this area. And even, recently we had a young person who was desperately struggling and isolated and was looking for community and support, but couldn't come to an organization that had anything to do with the term intersex. And, that's so heartbreaking, obviously, to everyone here, because what I hear in that moment is not just the experiences of this young person, not being able to go to the place where, we desperately want them to be able to provide support, but also that essentially the phobia of difference, and that had been sown in this young person through that same pathology, that creates the fragmented states that kind of we're in, and confuses the issues, and kind of makes new lines in the sand around, we don't get to come together in a singular movement. So again, the Darlington Statement you know, obviously there's lots of different terms in there, but I feel like that, you know, those politics can move to the side because the strength of the content is so tangible, you know, and it's not just, you know, it's not getting muddied by sort of other waters. It's sort of like being within the LGBTQI place, you know, it's just very much like from community, from those with lived experience. And so that's, you know, the strength of it that reminds me that these collective statements have power beyond just what they say, but actually the method of their construction.
That's an amazing thing to say, and like I just think that something that's really quite profound about it, and something that I'm so proud about the Darlington Statement, is the level of care and kindness in it. It tries to consider the different aspects of how having an innate variation of sex characteristics and the types of treatment that we receive as a result of that impacts us in our lives in different sections and different aspects, and tries to really name them all in a way that is quite inclusive. Do you know, like, we recognize there's still voices that have been left out of that process who weren't present at that time, because our community is still growing. Many people still aren't connected with other people, and our voices have been very fragmented. But to have one document that talks, you know, on widely ranging topics around like the right to marry, about children being properly having disclosure made to them, about getting access to our medical records, about the fact that we live everywhere in different regions, the fact that, you know, we, you know, data systems often fail us because they don't capture us, or they capture us in ineffective kind of ways. And this real melding of well-being alongside health that often has been very lacking in a biomedical model, that really feeds towards that, you know, peer-led services, and this idea that we come from all different backgrounds, but there's so much wisdom and intelligence and knowledge within our community, and access to community has always been recommended. And the more it's integrated within, you know, human rights-based multidisciplinary medical approaches, teams and services, would be the better the outcomes, you know, like the more psychosocial the approach to dealing with the stigma of difference, the better the outcome for the individual over the whole lifespan. And that's the great benefit of putting this all here in this diverse perspective, is it really takes the focus out of that pediatric childcare setting and really shows the intersex population for what it is. They're people of all different life stages with very different types of bodies, with very human needs and healthcare needs that are sometimes related to having an intersex variation and sometimes they're not. So other thing that I think is really important about it is the role of allies. It's the last, you know, it's the second last thing in the Darlington Statement, but those have been 3 Darlington retreats so far. The first one birthed forth the statement. The second was about the role of allies and looking at how how the vast scope of the Darlington Statement could be achieved through the process of people affirming the Darlington Statement. And that was one of the major outcomes of that second retreat. The third retreat that we had in 2020 very much was about looking at with an intersectional lens at people that weren't present in the first Darlington retreat. So looking at considering the Uluru Statement from the Heart and the Treaty of Waitangi, sorry, and also the drafting of a statement related to forcibly displaced persons. That third retreat as well also considered the recently drafted Yogyakarta Principles plus 10 that included sex characteristics as a category for international human rights protection. So there's been lots of work, and there's still so much work to do. And I don't know, are there any things that we can cross off the Darlington Statement as having been done? Would that be a fun exercise? Should we have a whole retreat just to do that?
Yeah.
I've got the magic markers.
The right to marry can be crossed off. But we all have the right to marry, yeah.
Correct.
In both of our countries. There's a couple of questions. I mean, Megan Osmond has asked, is resistance and pushback from the medical community lessening as new generations of medical practitioners are coming into seniority? So my experience is that that arguably medicine has a much more fractured response to these issues, with different specialisms increasingly saying different things. But the issue is not that there has been a generational shift. I don't think that we've yet seen a generational shift. My fear is that the senior clinicians, particularly in surgery, endocrinology, and urology, have recruited in their own image, or are recruiting in their own image, in what are essentially very small silos that don't connect very well to other parts of medicine, particularly affecting adults. And particularly the areas of, for example, mental health. So I think that we're seeing a much more fractured response within medicine. But I wonder if Bonnie, Manny, or Jolie have any thoughts that support or contradict that.
I think, clinicians are in a difficult situation, particularly the more established ones, because often a lot of the interventions that were received were done without long-term evidence. And so they're ostensibly experimental treatments that relied on clinical expertise and clinical authority, or the eminence of senior practitioners in those spaces. And the way that power systems work within clinical teams really privileges people kind of practice experience. So I can understand the difficulty that people have who have been practicing these things over many years to come to accept them as being human rights violations, because there's a lot of cognitive dissonance around that. So I can't imagine that those people would readily accept that and acknowledge it and allow for change of practice, because there's a vested interest in it to not change. That being said, as more and more pressure is put on from social institutions that position diversity as being good and healthy and acceptable and in places desirable, as opposed to the biomedical model that really does position normality as being desirable and healthy, it's now, now we're very much in an age of psychosocial well-being, and the fact that any type of intervention has to stand the test of time, really. So yeah, and with the clinicians that I speak to, on the broad higher level things, people want to see cohesion, I think, between the people that receive medical services and the people that provide medical services. So I think the intention is there, and I think the people in this spaces certainly want to do best by families and by children and by adults. But whether or not people have the capacity to really reflect on those really high level assumptions that they're making around what is a good body, what is a good life, what is a successful relationship, what is gender, what are sex, what is sex, all of these types of questions that often people don't think to question because they don't, they just exist within I don't know, on a tippy specialist end of a very, very long train of study that has denoted some things as being constant that maybe need a little reevaluation. It's a long answer.
So we have like 8 minutes left before the session is due to end. I think we may continue beyond that if people are okay with this, with continuing. There is so much more that we can say, I think, about the statement and about its future. I'd like to just ask Bonnie, Mani, and Jelly, if you have any thoughts on the future of the statement, on any issues or opportunities that you see to do better in future. Maybe Mani or Jelly, do you have any thoughts or comments?
So just the way it's turned out, both countries at the moment are on 2 different tracks. So politically, so in Australia, more towards the criminalisation, and there's been huge amounts of work in that area. And in New Zealand, we had the it's a complicated story, but the group working from the community with doctors, and out of that came the commitment by our current Labour government. So this government has committed $2.5 million towards a model that would commit doctors working with the intersex community to come up with a human rights-based model. Now, there's a chance that that could happen, but it's fragile, and it's fragile because next year we have an election, and the minister who currently supports this is herself. She's a lesbian woman, a person of colour, and has an investment in this area. But if we were to lose her and end up with a right-wing government, all that could go out the window and the momentum could be lost. So the option is on the table. COVID, of course, has really hindered and limited that process in terms of it's not where it would have been without this focus and spend of money in another area. So I don't know, we're at a crossroad point. And that's why this conversation tonight is so important. I think it would be great to bring us all together quite soon to have a conversation about, we've got the map, how do we make this happen? And I think it needs to be creative, because there's not one answer here. There's a multiplicity of things to do. They need to be intentional, and they need to be informed by past experience and knowing what works, and building on the strengths and alliances that we have, and identifying where the holes and gaps are and how we might fill that. So we're at a really important time, but as I say, we need to hold it and blend it also with where the planet is at the moment, and we're in a very different place than when we came together for that first creation of the Darlington Statement. Jelly, I'll pass to you.
Kia ora, Mani. Wow, big questions, eh? Yeah, I think, we've already talked about the growth that the statement has had, and the sort of inclusion of different voices, or acknowledging that there's always more voices to enter the space. And I think just continuing, doing some of that conscious intersectional expanding of how things can be understood culturally in different ways, and how to sort of marry that with the rights-based approach. I think will be really interesting, thinking about indigeneity, and I think just diversity of cultures in general. There's some really amazing gifts that we continue to receive from the Indigenous communities, kind of like post-colonial, well, I mean, we're still in a colonial state, but that sort of re-emerging indigeneity around embodiment. And it's a really it's a whole other webinar, I imagine, that we could go into. But yeah, sort of musing on that, I think we've spoken about the importance of that in previous discussions as well. And it's not something that you can force, so it will take time. But just acknowledging sort of the whiteness of this just intersex activism in this part of the Pacific, is really important for us to do.
Thank you, Jelly. I think that those are really important limitations or comments, I think, that we have to recognize. In the chat, Bonnie has shared some of the additional statements that we've made at subsequent community events. And in addition to the ones that try and highlight that the intersectional issues about living in settler states, we also made a statement on the climate emergency and disaster response. And we did that because at the time, Australia was in a bushfire crisis. And that has been followed since by, a pandemic and flood disasters that have affected, many of our community members. And we, I think, managed to presage some of these issues, highlighting the consequences of the climate emergency and disasters in our communities on our ability to come together. The event in January 2020 is actually the last time that our communities have gathered physically, face-to-face, in our two countries. And I think that we are all feeling the absence of that physical contact and that connection with each other, really in so many profound ways. It's not just about our interpersonal relationships, it's also about our ability to listen and speak with each other. We do have to come together in the near future. I hope that it will be possible. We've hit 7:30, which feels like, the scheduled time that we gave ourselves as the moment to close the event. And I feel kind of quite reluctant to do that. And so many of you are still here. But I maybe want to ask if any of you have any questions that you'd like to ask.
Well, I kind of want to just jump on in because I didn't get to answer about what my hopes were for the future. Just saying, because there's lots, basically, still our intersex-led organisations are still unresourced, largely speaking, and we still have so much work to do in terms of community capacity building to ensure that there are affirmative services for people to go to ensure that there are actually support groups, advocacy organisations that can do this work to try and continue the growth and objectives of the Darlington Statement, and to work with our allies in order to achieve that. So obviously the increased role of our allies, not representing intersex, but standing with intersex community members in order to achieve the aims are really important. Yeah, obviously all of those kind of the kind of like, I don't know, there's lots of things. I also just want to, yeah, I also agree that there's a lot more time just needs to be had to be able to reach people, to connect and create community and get the real representation that we know is out there. We know intersex is non-discriminatory in terms of how it occurs on the world, but yet we still find that our advocacy voices aren't representative in that way. And that's simply, I think, because of the compound effects of lots of the stigma and the psychological impacts, I suppose, of non-consensual medical interventions, and how that plays out for people and their ability to have good health literacy, to have access to voice, and to feel empowered to be able to actually even send an email to ask for help or support in that space. Like, we know that people don't click on the links when you send them to actually access support, because of all of these barriers that they have in order to do that. So yeah, that's what I would like to see more of, and yes, obviously more together time.
Thank you, Bonnie. There is a question or comment from Paul, which I'd like to come to, but maybe Marnie or Jelly, do you have any comments or thoughts before doing that?
I saw Elizabeth had their hand up, so.
Yes, thank you, Marnie. Look, I was really pleased to join this session. I only just learnt about it because I recently joined the Pride Network at TAFE New South Wales as an ally a few days ago, and they told me about this event, so I wanted to come and show support and learn what I could. What's interesting in some of the things in reading the Darlington Statement that came out to me was really the experience of some people of being an early school leaver and then becoming, in years later on, coming to an organisation like TAFE, and maybe finding that is hopefully a better experience than they may have had it at high school, and hopefully a more welcoming experience. One of the challenges we do have, though, is sometimes, we can offer a whole range of support services, but sometimes we're not that good at letting people know about what we can do, and how we can support people with reasonable adjustments, or really just to gain an understanding and create that really welcoming environment so people can engage with education and really open that, and that then leads up to more opportunities. It's certainly one life, and everybody should be able to live it as freely and openly as they possibly can, and be the unique person that they are. And I guess what the challenge will be is for me, I feel as an ally, is just knowing how you can help, what's the best way to help, but really to play that supporting role, because to me, it isn't about what I think may need to be done. It's certainly the people with the lived experience being able to design the solutions and be comfortable to say to an ally, can we help in some, can you help in some way? Whether it's putting on an event, or if it's turning up a show of support, or whatever it is, or if it's trying to improve the way that we communicate and the way that we work as an organisation, and the way that we participate in the community and the society. So I just want to say thank you so much for the invitation, and it's I've got all this information to read and learn, and certainly I'll go back to my workplace at TAFE and see what I can do to advocate and help in any which way I can.
Thank you, Elizabeth. Paul's made a comment about applying a human rights framework to reproductive health, and I think that it's essential that a human rights approach to reproductive health is taken by governments in our jurisdictions. And I think it's also essential that governments look more broadly than narrow conceptions around access to IVF and look at the full gamut of assisted reproductive technologies and services. And I'm really glad that we did put language around access to reproductive services in the Darlington Statement, and also comments about ending the use of IVF and other forms of technologies to eliminate intersex traits and deselect variations of sex characteristics as well. I think that we do still have so much work in trying to enable or more clearly get governments to acknowledge the full range of issues that we are raising. Because, I mean, Paul is making a comment about new free clinics in Victoria targeted towards female reproductive procedures. And yeah, I agree, Paul. I mean, that's inadequate for our population. We need to be ensuring that all of us have the same degree of access. So thank you for your comments, and thank you so much. Are there any more comments or thoughts maybe before we wrap up? Amelia, thank you so much for your comment.
And I'll just jump in here. Some of you know I've had an up close and personal experience with the medical system the last year. I've been hospital avoidant all of my life, and a summary is it's about effective communication. You know, the good experiences I've had have been people who know how to communicate and how to listen. But I've also experienced the medical system as reductive, and I've had some hideous experience as well. And I'm just thinking of the work of Katrina Rowan, and you know, she has done that work for clinicians about how to have conversations. And the first critical conversations are the conversations with parents, with caregivers. If we can get some resourcing and around that area, that's where the change will happen. And until those who love us, our parents, our caregivers, have toolboxes to be our advocates, until we can find our own voices and then connect with the peer groups. So yeah, I just want to, I've spent a lot of time the last 6 months lying in bed, not doing very much, and I've been thinking a lot, and I think that's the one area that we can work on. I just want to thank Morgan, you, Cody, for setting up tonight. It's been wonderful. Thank you.
Thank you very much. And thank you so much to all the speakers, to Marnie, to Bonnie, and to Jelly. Thank you, Cody, for your help making tonight happen. It's very much appreciated. Thank you for the comments, and thank you for the community members, particularly who are here listening and watching and making comments in the chat. I really appreciate your engagement, and I really hope that we can meet again face to face. Cody, you have your hand up, so please feel free to speak.
I wasn't just going to stay quiet this whole time, obviously not. I think what's been really, really special about tonight, and what's really put a lot of energy into a day where I was feeling very beat up and apathetic, is that we so rarely get to have these higher level conversations. I joke that, like, in order to get into activism, you need to be able to have the same 5 conversations over and over again until like you start coughing up blood. But like I think this has been a space where we've been able to celebrate the community, where we've been able to celebrate achievement, where we've been able to reflect on some things that are at that high level. And it's always such a privilege to listen to the people on this panel speak, and it's so exciting to see all the other people in the audience tonight. So thank you very much to everyone for coming along, and thank you so much for being on this panel.
Thank you so much. Thank you, all of you. Really appreciate you being here tonight. And please feel free to share the video after the event with anybody that you think might benefit, or feel free to watch again. Thank you so much, all of you. Please take care. Have a great night. Have a great day, wherever you are.
Happy Intersex Awareness Day.
Happy Intersex Awareness Day.
Thanks, everyone.
Thanks,
Wonderful
everyone.
panelists.